Welcome to Wellington's latest Wellington Community webinar. My name is Emma Arnath Pemberton. I'm the Director of Consulting Services and I am your host for today. Today we have a very special guest speaker with us, James Evans, who's a PMO Manager for NHS Wales, and he's really going to be sharing with us some of the things he's learned along the way when it comes to project management, specifically in healthcare. Welcome, James.
As Emma mentioned, I'm James Evans. I've been working in the healthcare sector now for about 11 years, give or take, and I've been working in a variety of different roles. Project and program management is kind of where I've now landed, but before working in that space, I undertook a variety of different roles in the healthcare sector, and I was actually working in these different roles I started to get exposed to different types of project management, and it's what kind of got me interested in it and knowing that there were different ways to actually undertake it. Outside of work, I'm an active volunteer with the APM, working as part of the PMO interest network as well, and also supporting a number of other activities outside to improve the profession. Today, I'm just looking forward to sharing my experiences of some of the stuff I've experienced working in project management, especially within the healthcare sector, some of the challenges that I've come across and the opportunities that I think this sector has to offer and some of the learning that we can share. So what I'm looking to cover today is basically the diversity of different healthcare projects out there. A lot of people think healthcare and think clinical, but you'll be quite surprised with the diversity of the projects that we actually are exposed to. Some of the challenges and pressures managing projects in healthcare. There are some unique demands that we're exposed to when we come to project management in the healthcare sector. Key learnings, and these are learnings really from my perspective, what I've been exposed to over the years that I've carried with me and taken into each role that I've gone into. And then just how project management has changed in healthcare and some of that future looking space of what it could be morphing into. So as I said, sort of starting off, it's looking at healthcare projects, that diverse landscape. One of the things that's really stood out to me is just how varied these projects can be. One day I found myself working on an IT project, rolling out a new digital system. And the next, I was sort of neck deep in service implementation, organizational change projects. And it's really varied from different sector to different sector, all actually within healthcare project management. I found that it isn't just about clinical projects, it covers a wide range of areas. So like I mentioned, estates, infrastructure, digital implementation, service improvements. You might find yourself building new facilities one day to upgrade an IT systems the next. And like I mentioned, organizational changes has been something quite common that I've been part of. So no 2 days have really been the same when it comes to project management, where you have a portfolio of work that you're covering. But each project brings in its own mix of stakeholders, which of course adds its own complexity. Take a digital transformation project, for instance. You might be working alongside IT teams for the project, but then you might also have clinical staff who are there to implement that system with the teams that they're working in, and then even patient safety teams, all trying to implement that new technology without it impacting their particular areas, but more importantly, the patient care at the end of it, which is what all this is about. So part of this was being adaptable. You've got to stay flexible, both in how you manage the project and how you tackle the challenges that come up, whether it is those sort of ever-changing tight deadlines or the limited resources that we find ourselves trying to manage those projects with. Or you might find that there's constantly shifting priorities with different projects coming online, some closing down, or the goalposts may move completely and you have to be able to prioritize and switch really quickly to adapt to that. The one thing that I think I've really learned about healthcare, and I'll touch on this later, is the unpredictability of project management in that space. So coming on to some of those challenges and pressures, one of the biggest challenges I've come across while managing projects in healthcare is juggling the needs and expectations of all the different stakeholder groups. Whether it is IT, finance or clinical teams, each group is really focused on its own priorities. And as project managers, we're often a bridge working to bridge these groups together and keep the projects on track. So it's been always like that sort of negotiating and using those skills to keep, just try and keep everyone happy, but keep everyone's expectations managed. And in healthcare, you really get to interact with such a wide range of stakeholders as well. And they all have their own sort of nuances around how they like stuff to be managed, so from the clinical staff to the hospital administrators, even then to when you start bringing external contractors in and like policymakers or even government. Each one has got their own priority and agenda. So the challenge is finding our way to balance their competing interests while still making sure that your overall goal of that project is still being pushed forward. And I mentioned previously that healthcare is unpredictable. And I know we're a few years on from it, but it's still one that it's still lingering around in there. That what happened with COVID. So you can have sudden surges in patient admissions. The public health crisis like pandemics or new government policies that completely shift project priorities overnight. So in the pandemic, we found a lot of projects got stood down, but what we did find in the pandemic was a lot got stood up as well, and project management really came to the forefront in the healthcare sector with things like the Nightingale hospitals and other big priority projects that had to be established at speed, but in a very sort of agile way of working as well. On top of that, most healthcare projects run on tight budgets with limited resources, whether it's staff shortages, budget constraints, or the increasing demand for healthcare services. We've got to be resourceful and really innovative in the way that we deliver projects successfully, often using less resources than we would like to use, but finding ways that we can navigate around that. And the one thing I think is really core to remember is that the stakes are quite high. Some of the projects you'll be working on can directly impact patient care at the end of it. So when you are actually working in those projects, the success or failure of the project can actually have sort of life-altering consequences to what the outcome of that project was. If it's implementing a new clinical system, you've got to remember that when you're managing things like risk and that in there, the risk is far beyond just the project. It can actually be towards the patients as well. So some of the key learnings for healthcare projects. When I first started managing healthcare projects, I quickly realised it's about a lot more than just tasks and timelines, that you're constantly navigating a fast-paced, ever-changing environment with loads of stakeholders, competing priorities, and just non-stop change. Right from the start, I had to build up a set of skills that would keep me up to speed and sort of succeed in that space. And these weren't just the sort of typical skills that you would get from some of the project management courses. These were some additional key skills that I started to bring in as I learned with experience. Adaptability was key for me. As I mentioned, in healthcare projects, they can shift at a moment's notice. Things like COVID-19 was a real thing for me in my career, where a lot of the projects I was working on stopped and I got moved on to priority projects to support the efforts around the pandemic. And it's just about reacting to the changes. It's also about being proactive and anticipating them. Some things you'll never be able to predict, but that adaptability and being able to be flexible and change your way of working at a moment's notice, even when things are completely unpredictable and uncertain, was absolutely key. Strong communication. These are some of the key skills you would get in all project management, but communication has been key in any of the projects, especially in healthcare. Due to the number of stakeholders involved and those different types of stakeholders, when you're mixing clinicians with IT teams, finance departments, regulators, you need to make sure that communication is clear and consistent and that everyone stays on the same page. And often I sort of joke around that you're almost acting as a translator between those stakeholders as well, to keep up with their different interests of what they're looking for. So you're often that bridge between technical and the non-technical teams, and just managing everyone's expectations in that space. Risk management has been huge. So healthcare projects do come with a lot of risks, as do any projects. But from patient safety issues to budget constraints and data security, being able to manage these risks effectively has been one of the most important skills that I found I could have. Tools like RAID logs help to track and mitigate those risks early on, but being the project manager, it's been more important to be able to spot those potential risks before they turn into those issues and work out those innovative ways to actually start mitigating them or even preventing them from even happening in the first place. So it's coming out of different ways to come around those risks. I've mentioned a lot about stakeholder management. Managing stakeholders is an absolute priority. Clinicians will always be focused on things like patient care. Finance will be looking at the costs within the budget. IT will be concerned about how the systems are integrating if you're trying to bring in something like a digital implementation project. But it's really key to find that balance between their competing interests while keeping those sort of strong relationships with all parties. And it's really about understanding each stakeholder's perspective and why they're thinking the way they are and aligning them all towards that common goal of that project. So what was that overall aim that you've set out at the start, and keeping everyone aligned to that goal allows that successful project delivery. And then it's just having a good understanding of healthcare context as a whole. I'm not a clinician by trade. My experiences are quite broad within the healthcare sector, and I have had some operational positions, but it's never been as like a doctor or nurse or anything clinical in that sense. So, but still keeping myself an understanding of the sector's unique environments has really helped. So this includes just understanding the different regulations that are around, understanding what the patient-centered care priorities are. So with the organisations I've been in, understanding the strategy and the different parts that they are trying to align to is absolutely been key for delivering those projects, and being able then to communicate that out to the stakeholders and manage the risks with them appropriately. These 5 skills: adaptability, communication, risk management, stakeholder management, and a deep understanding of that healthcare context, I found have been like the foundational key skills I've needed to manage the pressures within a healthcare project. So when it comes to the changing landscape of project management, I've been fairly lucky that over the 10 to 12 years I've worked in the NHS and the healthcare sector, I've seen like a change within project management. When I first got started, most projects were run in what I would deem a very traditional way. And while that worked for a while, it didn't take long to realise that healthcare, being as fast-paced and as complex as it is, needed something more adaptable. And over time, I've seen teams adopt new approaches and technologies that have not only made our work more efficient, but it's also made it more human-centered in its approach as well. So this includes the shift from more traditional to agile approaches. This was really evident around the pandemic. That before that, I was still seeing a lot of the sort of traditional waterfall approach in how we were planning. The moment the pandemic came and we started having to work more agile because we were forced into that position, it stuck. And following the pandemic, the projects I've been working on since then, agile has become a bit of a buzzword, and it's starting to be seen that having that flexibility and being able to iterate and the sort of fail fast, move on, and keep going with the project has been really beneficial in the practice. Lean has become a lot more involved within the project management practice as well. Cutting out waste, working on the efficiency of the project. So again, I mentioned that low resource might be one of the issues that you have within the project. By making the project as efficient as possible, then you are absolutely getting the benefits out of it by reducing any waste early on. And more recently, I've started to see the sort of digital transformation really come to light within project management in the healthcare sector. So the pandemic forced tools like MS Teams and Skype and the video talking software start to come to light to be able to communicate in those remote settings and be able to get the work done. But as digital transformation has gone even further now, we're starting to see a lot more use of Power Platform usage and digital dashboards to help us inform decision making. These tools have given us real-time insights into how projects are progressing, rather than a rather subjective sort of spreadsheet that might have been used for a Gantt chart in the past. and it's only getting smarter with the introduction of AI coming into that mix as well. You can only just see how far digital transformation is going to take us within that project management space, and I think there's still huge opportunities to take that even further. And I mentioned about real-time data. Having access to that real-time data is making quicker and more informed decision making. It's making managing risks more proactive and ensuring that the resources are going where they're needed most with that real-time information. And something that I've taken a personal interest in is around how human factors is starting to become a real key element of project management. And I've seen that there's been a bigger focus on things like psychological safety within project management. And it really increases things like risk management then, because if everyone feels safe within the project to raise concerns and identify issues, or without that sort of fear of being judged, it leads to stronger collaboration within the team, and those projects become stronger straight away. And these are the sort of future parts that I think are only going to broaden, and we'll probably see a lot more of these being talked about going forward. So that is it in a sort of quick shot of it. I could probably talk for hours on this space of various things I've seen, but yeah, with the time I got, that's it.
All that's left for me to do is to thank James. It's short and sweet, our webinars, but hopefully they're like impactful. So thank you so much for joining us, James. We've really appreciated your input.
Well, thank you very much for having me.
Amazing. Thank you all, and we'll see you at the next event.